Hello, and welcome to another edition of A Closer Look. I'm Dave Salone, and I'm here with my colleague, Dr. Diane Roston, and we're representing West Central Behavioral Health, which is a nonprofit community behavioral health clinic, which is based in Lebanon, New Hampshire, with offices in Lebanon and Claremont and Newport, New Hampshire, and we serve Sullivan County and the Upper Valley. So I'm glad you're able to join us today, Diane. I appreciate it.
Thank you.
Was hoping to just sort of have a conversation about what's going on at West Central Behavioral Health and talk a little bit about some of the work that you do and some of the various programs that West Central offers to the local community. And it's nice to be here on Community Access Television. We appreciate their giving us the time and the support to tape this program. So I guess to start, maybe you can just tell us a little bit about how long you've been with West Central and what attracted you and what keeps you coming back.
Good question. I've been at West Central over 20 years.
Okay.
And when I first came to West Central, I was working part-time, just doing clinical psychiatry work in the clinic. And I really liked it. I liked the team aspect of it. I like taking care of people. I like the population that West Central serves. I've been in the position as medical director since 2007,
Okay.
and I like that as well. The combination. I still do a little bit of clinical work and also the directorship, and I like that combination. West Central does really remarkable work with people.
Now you mentioned that you like the population that West Central serves.
Yes.
What is that population?
So West Central serves a very broad population. Age-wise, West Central works with very young children all the way up to very elderly, men and women. As you mentioned, we serve the catchment area of southern Grafton County and all of Sullivan County, and a very wide range of conditions. So anything from adjusting to life stressors on the one hand, and on the other hand, to severe mental illness such as schizophrenia, bipolar disorder, depression, anxiety disorders. And so we serve a very wide range of individuals.
Okay, and I know we say we're the community mental health clinic for the Upper Valley and Sullivan County, and we're one of 10 community mental health centers in the state of New Hampshire. Having started in 1977, so it's been a while. So we've been embedded in the community for a long time, and I know we serve clients, and I'll just sort of interject some of my own thoughts here because having worked at West Central now for a little while, I've gotten a handle on some of the statistics and the data and the demographics. I know that we served last year more than 2,200 clients, and of that population, roughly a quarter were children, ages 2 to 17. And then about 50% was sort of ages 18 to 60. And then the other 25% ages 60 to 94. So it's a really broad spread. So we've got clinicians, therapists, psychiatrists that are serving that population. Does it all happen behind closed doors? What do we work sort of more broadly out in the community?
It's a good question. We do have some things that happen behind closed doors. We have individual therapy. We also have group therapy that is office-based. We also go out into the community. For example, we have case managers who go out to the community and help people do basic life skills like shopping if they need help with that. We also have supported employment specialists who will go out into the community and help people with work and with employment.
So is that the piece on supported employment? Is that something where we've got people who are really just focused on working with our clients to find them jobs, to get employed, to stay employed? But do they also work with the business community to figure out where those jobs are?
Yes. So the two sides, so supported employment is an evidence-based practice. It's been studied for a long time. In fact, it was originated by one of the former medical directors at West Central, Dr. Bob Drake.
Oh, is that so? Yeah.
Yeah. Actually, I take that back. Bob Drake was a big part of it. It was originated by other people as well.
Yeah.
And two big things that supported employment specialists do. One is that they do go out into the community and they form relationships, community partnerships with prospective employers. And they also work with our clients who are interested in getting a job and working. One thing I like about the program is that the only requirement is that a person have an interest in work.
Okay.
So there's no expectation that your symptoms have to be under control or you have to stop drinking first or anything like that. If you're interested in working, the specialist will work with you and help you.
So it sounds like working almost serves as a form of therapy.
It's well known that working is a very important part of recovery, and that people do better, like we do, like we all do,
right,
when we're gainfully involved in community employment
right.
or community work.
Gives us a focus, gives us something to do every day. We're not sitting around just sort of waiting for whatever it is that we might be waiting for, which can be hard, I imagine, particularly if someone is suffering from mental illness or is, a substance user of some sort.
Right.
Yeah.
I think it's really a change in the perspective about mental health care that I think it used to be thought that if you're dealing with chronic mental illness, then you really can't work. And nowadays, I think almost 50% of the clients at West Central are employed.
That's great.
Probably 40-something.
Right.
And the expectation is that people are going to be employed if they want to be, and we'll help you.
That's great. So for employers out there, if they're seeing this, they might want to contact us. And I know that the job market it's a difficult time to hire good people, and so we're certainly in a position to be able to refer clients. It sounds like.
Yes, and they're typically hard workers, and with the support of a support employment specialist, if there are difficulties, they get through them.
Right. Right, and so some of the supported employment tools that we have that we offer clients would be things like helping develop a resume or interviewing skills or what kind of job to look for or transportation to and from work, those kinds of things.
That's right. So it's the basics of a standard career counselor.
Right.
Plus the kind of things that you're talking about.
Okay. And then
transportation
then they stay with the client during the employment to make sure that if questions come up, they sort of help.
Correct.
Basically. Okay.
That's exactly right.
I think supported employment is one of those things that people, it's another one of those programs. We offer lots of programs.
Yes.
And so I'm interested in hearing more about other programs from you that you know about that you might be able to share with our audience here today. And one of them that I'm thinking about that I've heard is called the In Shape program.
Yes. This is another fantastic program. These programs are available in both of the adult clinics that we have. One is in Claremont and one is in Lebanon. The In Shape program also is an evidence-based practice. It was initially started by Ken Ju, who was at Monadnock Family Services in Keene. And the program provides a health mentor to individuals who would like to get in shape physically. The health mentor is trained, and he or she provides an individualized exercise program as well as nutrition support and information. There also are classes that are available and group activities such as a walking group or a pickleball group 1 year.
That sounds like fun.
I know.
So this sounds like almost sounds like a cross between a personal trainer and a therapist. Or a coach,
that's
or
exactly
a health
right.
coach and a therapist.
Personal coach. In fact, I tell the health mentors that I want one of those.
Oh, that'd be nice.
They're really excellent. And in fact, people get better. People's fitness gets better. People lose weight. People's food choices change.
Yeah, and I know we've done things with like the Hanover Food Co-op and
Right.
King Arthur Flour. We work with the CCBA as a fitness facility.
Yes.
There's a fitness facility down in Claremont, which is Real Steel Fitness. They're another one.
Yes.
So these are some other sort of touch points in the community where we're engaged.
Right. Right.
Which is nice.
Which is really nice. And the community, we're always looking for new community partners, another plug if
Right.
community agencies are interested in this. It's an opportunity to give back to the community for individuals who are chronically mentally ill to use these services.
That's great. It's another great outbound program
Right.
that's sort of new to me. And then there are some programs that are not maybe as outbound, but they're new, and I'm sort of starting to hear about them. And I know you know about them because you've been working on them for a while, and they're starting to materialize now, which is exciting. And I've heard about integrated care as being one. I don't know if you can say a little bit about what's going on in the world of integrated care, what that even means.
Yes. So integrated care means integration of mental health care and physical health care. And the idea is that these two really belong together and merge together. And so there are a number of different models to look at that. And West Central is involved in research looking at some of these different models. We're part of a funding grant called the IDN, Integrated Delivery Network, which coordinates different models of care for mental health and primary care doctors to coordinate services together. We've been working with the Dartmouth Heater Road Clinic and also the Dartmouth Hitchcock General Internal Medicine Clinic, Alice Peck Day, Valley Regional Hospital, the Newport Health Center, and working on different models to coordinate care for the most ill individuals that we serve, who often fall through the cracks. And so far, it's early. We're in the middle of this process, so we don't have any data. But so far, at least my experience is that it's been very helpful to individuals who need that kind of coordinated, integrated care.
So we would have a primary care practitioner in our mental health clinics. Does it work the other way sometimes, where the primary care clinics have mental health practitioners there? Which model is?
Right.
Is there one that's better than the other?
Well, so far we actually have not had a primary care provider in our clinics, but
Okay.
that's something that we're aspiring to have at some
Okay.
point in the future.
Okay.
We have had models of mental health providers in primary care settings. We did this in the Newport Health Center for a number of years until they hired their own internal mental health staff.
Right.
Right now, there's a shared care plan that's coordinated with the sites being still separate. So the West Central will be providing West Central services, and the primary care provider provides their services. But there's a coordination in terms of a shared care plan of making sure that we coordinate services together.
Okay, and one thing that's sort of near and dear to my heart as Director of Development and Community Relations is the funding model. Even though we are associating with other organizations, be they hospitals or primary care practices and things like that, we are our own nonprofit organization, standalone.
Yes.
And even though we have affiliations with places like Dartmouth Hitchcock or Geisel School of Medicine, from a funding standpoint, we're floating on our own bottom pretty much, and we've got to self-fund. And I know that given our population, which is roughly 85% of our clients are Medicaid or Medicaid-eligible clients, and knowing the funding model from Medicaid,
Right.
it's basically supporting about 73% of the cost of our services overall, we still have to raise private support to fill the gap in order to deliver the amount of charitable care that we have delivered, which I think last year amounted to about $600,000.
Yes.
So we see a lot of clients. We're sort of working with a very vulnerable population,
Yes.
both in terms of health, mental health,
Yes.
substance use, but also in terms of financial health, right?
Yes.
So
very, very true.
okay.
Yeah.
So that sort of turns us into the nonprofit that we are, where
Yes.
we've got to get out there and look for private sources of funding from individuals and foundations and corporations and things like that.
Right. And Medicaid, as you said, is 85% of the the reimbursement that we get doesn't cover the cost of services, and so we really depend on the generosity of individuals and corporations and other funding sources.
Great. Yeah.
So thank you. If you've donated to West Central, thank you very much.
Yes, and if you're willing to donate, we thank you in advance.
Yes, right.
So, but sort of back to the programs that we were talking about, another one that seems to be buzzing around out there is medication-assisted treatment.
Yes.
And I know we were in a meeting on this a couple of days ago. Maybe you can add some color to that.
Yes, I'm really excited about this program. It's scheduled to start in the next month or two. This is a program that's going to be in our substance use center in Claremont, which is on Elm Street. I don't remember the exact. It's on Elm Street. It's right next to Valley Regional Hospital, and I don't remember the exact address. Perhaps do you know the exact address? It's,
so I think it's 252 Elm Street.
252 Elm Street.
And in Claremont.
In Claremont. And we really felt that Lebanon has quite a number of services to serve individuals with opioid addiction, but Claremont really doesn't have adequate services yet. And we know that one of the biggest health concerns in our state is the opioid epidemic. We are far and beyond one of the most affected states in the country. We are going to be starting a program that is based on Suboxone, which is similar to methadone in that it's a replacement therapy for heroin or opioid medicines. And we're really excited about it. We have individualized treatment, which will include meeting with the doctor as well as meeting with an individual counselor, and really tailored to the needs of each person. And I think it's going to be a really top-notch program.
And so you say individualized treatment. Is that unique or different from what other organizations are doing?
It is actually. Many organizations who do medication-assisted treatment have a group treatment model where even with meeting with the doctor, it will be a group of individuals rather than one-on-one, and the therapy is also group therapy. That certainly is a lot better than not having any treatment at all.
Oh, yeah.
I think it certainly is a reasonable model.
Right.
And I think that ours is going to be one step more personalized than that.
That sounds great. Well, I'm glad we're doing that, and that's to address the opioid epidemic. So we're talking about heroin or prescription opioids or non-prescription opioids. Those are the kinds of things that we're talking about.
Right.
Trying to help people who are using those substances.
Yes.
And while we're on the topic of substance use, perhaps we can talk a little bit about, for the audience who might want to know, what are some of the other issues out there in the world of substance use that are happening? I've heard things like bath salts. I don't know what they are.
Right.
I know there's vaping. I know there's alcohol. I don't know what else might be going on, and maybe help me out with bath salts because I don't know what it is.
So, bath salts is a synthetic. It usually is a synthetic amphetamine, but a lot of things get called bath salts that are a variety of different substances, and they're always changing. And so one of the difficulties in treating bath salts is that they're always changing. There's not an easy way to measure them in terms of checking a level, and the effects can be frightening and unpredictable because they're not well understood. People sometimes end up in the emergency room with physical consequences of bath salts that they couldn't have foreseen.
Interesting.
So very, very worrisome.
Yeah.
Yeah.
And alcohol, I'm sure, remains a big...
Alcohol, alcohol is number one in my mind.
Is it?
You know, I mean, the opioid crisis, I think, is a crisis because it's so new and so prevalent.
Right.
But alcohol is is always a pervasive problem for us.
Right.
And we have services to provide, particularly in our Claremont program, to provide substance use counseling for all substances, including alcohol.
Okay, and I've learned recently, and this may be an aside, but we have a pharmacy in Claremont, which
We do have a pharmacy.
I just learned.
Yes,
So-
we have a pharmacy, Genoa Pharmacy. It's based in our Claremont Adult Clinic, and it provides medication to all the different sites. So provides medication for clients and their family members, also actually for staff and their family members.
Oh, that's good to know.
Yeah,
All right, maybe I'll be down that way
Yeah,
sometime. Maybe
yeah.
I'll have a need. And I know emergency services, and I'll put this number out there, is 800-564-2578, and we take a tremendous number of calls
Yes.
on that line. I've heard that it's something like 5,000 calls per year.
It's thousands. It's thousands. And anyone can call and talk with. These are master's level. I think all of them are MSWs, and can call, and someone will call you right back.
So MSW, Masters of Social Work?
Master of Social Work.
Okay.
correct.
And what happens if sort of an elevated response, like beyond the phone call,
Right.
if that arises, what do they do?
Yeah. If it's during business hours, they can come into the clinic and meet with an emergency services specialist. We also cover the emergency room in Valley Regional Hospital in Claremont. So if someone goes to Valley Regional Hospital, they would see one of our emergency services staff there.
Okay.
We can also facilitate someone going to a hospital if they need to have care in a psychiatric hospital.
Okay, good to know, and good program to
Yeah.
offer.
Yeah.
And I know it's been ongoing for a long time.
Actually, one other thing I wanted to mention about emergency services, and that
Sure.
is that emergency services often provides care to the community at large. So, for example, if there's a crisis or a suicide in a school or an agency or a place of employment, West Central Emergency Services staff often come and help with dealing with that situation.
Good to know. That's helpful.
Yeah.
And while we're on the topic of sort of outreach into the community, I know we have some programs that do that.
Yeah.
And particularly around the area of, well, which is part of our mission and vision, which is to destigmatize the mental health or mental illness and substance use disorders, and the sort of hold that has on our society,
Yes.
which oftentimes prevents people who need help from seeking it out because they think they're going to be marked in some way, right? But one of the programs that we offer, I know, is called Mental Health First Aid, which I like to think of as CPR for the brain.
Yes.
But we offer that in a variety of ways, and maybe you've got sort of a quick thumbnail of
Yes.
what you can say about that program.
Yes. Mental Health First Aid is an 8-hour program of training, very much like basic first aid for physical emergency conditions, that really helps individuals become comfortable and familiar with the kinds of steps that one takes in a mental health kind of emergency situation. It's a terrific program, and I know we have a couple of programs coming up.
We do.
Which I think are on the website. I don't know if you have
We do,
information
and
now.
people can go to our website, which is wcbh.org, and take a look there should be a button that says take a mental health first aid class. But I know that we've got one coming up at the Sullivan County House of Corrections, which is in Unity, New Hampshire, on March 20th. And that's open to the public. And we can typically fit up to about 30 people. And it's a free class. We've been able to get funding to offer that to the community. And we also have others coming up which are not necessarily open to the public, but there's one coming up at Hypertherm in Lebanon, thanks to the Hypertherm Hope Foundation and Hypertherm itself, who are offering that class to their employees and other employers outside of Hypertherm who are coming in for that class. And we have another one, we've offered them, I think, on and off at Hanover High School, coming up in March. I don't know the specific date, but we also have some information on our website about that. I think it was a podcast that Nancy Noel and Katie McDonald did So if people go to our website, again, wcbh.org, and go to the About page, there's a little drop-down tab, and you can click on podcasts, and you can listen to that. There's also some other information out there on that little About tab, which includes newsletters. We're producing a monthly newsletter that's going out on a regular basis by email, and we place it there. And we also have some publications of interest. So there should be another tab there that people can look and see what's going on. So we're sort of in this mode of trying to provide information to the community, provide education to the community, to integrate with the community. Other community organizations that we interface with, do you have a sense of sort of some of those other organizations broadly?
I mean, did you have any? I mean, I have a number of different thoughts about
Well,
that.
I know, for example, with this mental health first aid class, it's going to be at the Sullivan County House of Corrections. So we must do work in correctional facilities. So that's one thought that comes to mind.
Yes. So we actually have. Let me back up a little bit. One of the things that West Central does is provide educational training to psychiatry residents, child psychiatry fellows, medical students, and others. And we have psychiatry residents who go into both Sullivan County House of Corrections and also Grafton County House of Corrections. So we serve the jails. We also have a geriatric psychiatrist who serves many of the nursing homes in our community, including Sullivan County Nursing Home. And so we're out and about a lot. We have another relationship with the Mascoma school system where we serve a consulting role to the staff there.
And I know we've done some work with Kendall at Hanover.
We've worked with Kendall, right.
With the mental health first aid class, we're in Hanover High School.
Yep.
So we have those touch points as well. And I know I've just been given the signal that we have 5 minutes left.
Oh,
so we're coming to the end of our time. So I just want to just ask a couple other questions. And one which comes to mind is whether West Central is able to treat everyone who calls. And if we're not, either what do we do in terms of referring people, or what should they do? What should their expectations be?
Yes. I'd love to say we could serve everyone who calls, but I don't think that that's true. We have a limitation in terms of the geographic area that we serve. We also have been experiencing staffing shortages. There's a shortage nationwide in psychiatrists and clinical social workers and psychologists. And so sometimes we are not even able to have as many open times to see people as we would like.
Right.
The way to get into services at West Central is to call the intake number,
which is 603-542-5128 for people who want to call.
Yes, and when you call that number, the person who answers will talk to you and sort out whether West Central can be of help to you or not. And if we're not able to be for some reason, you'll get some guidance and ideas about who else you can contact who might be helpful. So we really try to help everyone who calls that number to
that's
get
good
services.
To know. If someone is in crisis, or if you know if someone is in crisis, what do you suggest as far as immediate steps that they should take?
I mean, certainly anyone can call the emergency services number. If it's more urgent than that, certainly go to an emergency room. But emergency services is often a good place to start.
I hope that our audience out there who's watching us, whether they're watching us on the CATV channels, or whether it's online somewhere on a computer, or whether they're hearing this on a podcast, will have learned something as a result of this conversation and the information you've provided.
I hope so too. Thank you very much.
So this is great. So that's our episode of A Closer Look, and I know there will be another one coming up. And we want to again thank CATV here in White River Junction in the Tip Top building. You may be hearing trains behind me because we're right by the railroad tracks. But this has been a great space and a great conversation, and nice to chat with you today, Diane.
Nice to chat with you too.
Thank you.